Hi, this is Chuck Martin. We're at the AI Summit in New York City, and I'm happy to say I have with me today Latoya O'Gere, Director, Optum Advisory Services. Welcome.
Thanks, Chuck. I'm very excited to be here.
So you're a nurse,
Yes.
and we're dealing with AI. Tell me how that connects.
That's so important because, believe it or not, in healthcare, we use a lot of technology to enhance patient care and make sure that we're delivering optimal care to our patients. So for me, representing healthcare at the summit this year, I plan to learn as much as I can that we can now translate back into healthcare in order to deliver excellent care for our patients.
So what kinds of things are you looking for in AI?
So for me as a nurse executive, we develop a lot of innovative programs that can enhance the way that we deliver care to patients. I lead the ambulatory care management pillar within our organization, and one thing that we leverage a lot with solution building is around looking at risk stratification methodologies, as well as looking at ways that we can predict what the intervention should be for patients before they get too complex where they need to go into the hospital.
So where does AI fit in that?
I think it fits at the solution pillar within how we can deliver better care and how we can enhance the services that we provide for patients. For example, as we look to outreach members within the community, we can leverage chatbots instead of a clinical nurse calling the patients constantly. We can also look at ways that we can automate the clinical documentation for clinicians so that they can spend more time educating the patients and their clinical documentation isn't a burden that can become somewhat extensive.
So you must be dealing with privacy issues in this. Where does that fit?
That fits I think it's at the top, believe it or not, and it should always be at the top because with healthcare, we're very regulated. And because of that, we have to make sure that we're enabling safeguards that promotes privacy, confidentiality, making sure that we're securing all the important healthcare information, because there's a lot of threats out there, but for us in healthcare, we want to make sure that we're following the regulatory standards and all the privacy acts and confidentiality acts. When it comes to data, we look at outcomes a lot, and with those data, it's also important that we're safeguarding how we share them between the payer and the provider spaces. So for sure, it's at the top of what we do.
So what's the biggest thing you want to get here?
I love networking, learning a lot from all the different vendors, seeing what's out there as we look to the future into 2024, getting a better picture as to what other technologies that we can leverage that can support care management both on the hospital care management space as well as the ambulatory care management space.
So a year from now, we're sitting here having the same conversation. What would we be talking about? You be an expert by then?
Yes, I'm part of the visionaries community, so attending those roundtables has been very informative, and it has enhanced my knowledge in the AI space for sure.
Well, I look forward to that conversation. Thank you so much. This is Chuck Martin at the AI Summit.